Thanks, John. That's right, anyone who will listen. And in this last session, thanks to the organizers for inviting me and to all of you for listening. We've talked so much about the regional and the local work, and so I'm going to close the day by talking a little bit about advocacy efforts at the global level to make sure that maternal, newborn, child health, and reproductive health remain a global priority. As John mentioned, my organization, Family Care International, has been advocating for more than 25 years to ensure that pregnancy and childbirth are safer around the world. And my fellow panelists and lots of you in the room are also involved in this global advocacy movement, which seeks to really make the goal of this conference real, to make every mother and every baby count. So Raj and others have covered this point already, but why is advocacy on maternal, newborn health, child health so important? We've heard about the MDGs being off track for achievement, particularly MDGs 4 and 5, and the advocacy community is working on this unfinished agenda she referred to. I heard one of the questions from the audience on Friday, which I think was so important, saying that we talk a lot about maternal health, but not always about its connectedness to newborn health. And as you can see from this slide, there is important advocacy work to be done on the newborn health piece as well, since reducing neonatal mortality is going rather slow. We also heard a call already for the need for more money for health, not just more money for meeting the MDGs of health, but more health for the money, a better return on investment. You see here that there's a substantial funding gap that remains for meeting the health MDGs, but the thing that's most important about this gap is that almost half of these costs are related to women and children's health. The bottom band for direct costs for programs targeting women and children, and the middle band for the health system's costs. So advocacy is needed not just to mobilize the resources towards the MDGs, but to ensure that these particular implications for women and children's needs going unmet are addressed. Now, Dr. Harshad Saghvi beat me to using these really interesting maps, but I wanted to share them with you because I think they point out the need for global and regional advocacy to accelerate progress in high-burden countries and regions of the world. So where the blob of the continent is larger, the need is greater, or the number of neonatal deaths or maternal mortality is greater. They also remind us that advocacy is needed around the disparities and inequities amongst regions. I wonder if you can guess what that map on the top is. On the bottom, we have neonatal and maternal that are sort of weighted to Africa and Asia. Does anybody know what the top map is? No guesses? It's the number of nurses, the number of health workers distribution. So you can see, as Dr. Lalonde pointed out, a real need also for advocacy around the importance of the health workforce. So it's great to be here speaking to this conference in particular, because when you look at our global advocacy targets, the folks that we think are best positioned to make a change in maternal and newborn health, it's most of you in the room. Raise your hand if you're on this list. A Ministry of Health or Finance official, a donor, an NGO, implementing agency. I know you're out there. So we look forward to working with all of you on these global advocacy initiatives to make change. Let's take a look at some of the key initiatives and partnerships that are happening at the global level. So you heard reference to this already from Raj and others. I think a real key to increasing global visibility and focus on MDGs 4 and 5 was the launch of the Every Woman, Every Child initiative by the Secretary General in September 2010. The Every Woman, Every Child initiative is part of advancing the Secretary General's global strategy for women and children's health, which aims to save the lives of 16 million women and children and strengthen financing, health policy, and improve services. When, at the launch of this global strategy, $40 billion in financial, policy, and service delivery commitments were made, not just by governments, but also by NGOs, by donors, by health professional associations, and academics. I was at that summit at the United Nations, and it was such an amazing moment and a reflection of the increased focus on MDGs 4 and 5 to hear head of state after head of state, president after prime minister, talking about the need to focus on maternal, newborn, and child health. This is what the global advocacy movement is seeking to achieve. We also heard about accountability and the commissions that have been established as part of Every Woman, Every Child to ensure that those promises don't just remain promises on paper or speeches that were given at the UN, but are actually put into practice. And some of you who attended satellite sessions this week heard about a third key component of the Every Woman, Every Child movement, the new UN Commission on Life-Saving Commodities for Women and Children's Health. We heard great briefings on the work of this commission to increase access to life-saving medicines and reduce barriers to maternal, reproductive, child health, and newborn commodities from our partners at PATH and USAID. And when this commission releases its recommendations on these commodities for maternal, child, reproductive, and newborn health later on this year at the UN General Assembly, it'll be the beginning of a new advocacy opportunity to promote some of the key commodities and interventions we've talked about at this conference: oxytocin, misoprostol, magnesium sulfate. The Commission's focus on misoprostol for postpartum hemorrhage, for example, is a great complement to the new guidelines we heard about from WHO and FIGO, and a real chance to continue promotion of miso. I heard on the last panel questions about why is it not on more essential medicine lists, so we're hoping that this high-level advocacy will help change things at the country level. In order to conduct this advocacy and influence these high-level policies, we need partnerships. And I wanted to flag for you a key one, the Partnership for Maternal, Newborn, and Child Health. Many of you in this room may be members of the partnership already. The partnership is based at WHO in Geneva and works with key constituencies, NGOs, donors, healthcare providers, et cetera, to promote collaboration around improving and accelerating progress on MDGs 4 and 5. It's more than 450 member organizations work to provide evidence, like the Born Too Soon Global Report on Preterm Births you heard about earlier today, and to conduct high-level advocacy for changes on policies. The partnership also plays an important role in the accountability for the Every Woman, Every Child process. They're holding a series of multi-country workshops on strengthening results and accountability for women and children's health. And the next one is here in Asia at the end of May in Sri Lanka, hosted by the World Health Organization's Southeast Asian Regional Office. Those workshops bring together Ministry of Health officials and other key stakeholders to create accountability roadmaps on maternal child health. It's also important for us to have data, to have indicators to make the case for why additional investment and action is needed on reproductive, maternal, newborn child health. And one way we get that data is through an initiative called Countdown to 2015, a global movement since 2005. You can see the broad range of partners that are a part of collecting data and working on analyzing data. Countdown tracks progress for maternal, newborn, and child health in the 75 highest burden countries. And we then use that data we analyze it and disseminate it at the country level for advocacy, and it's really important for accountability. We can show in the Countdown reports coverage and quality of care, which have been themes at this conference, financial inputs by donors so we can advocate for more, look at health system strengthening, et cetera. Some of you may have picked up copies of the RED report. It's pictured there in the corner, our new accountability report, which is tracking some of the indicators of the Commission on Information and Accountability. And there will also be a new global data report with full data spreads on those 75 high-burden countries launched in June at the same time as the Child Survival Call to Action in the US. If you didn't get to pick up a report, don't worry. The Countdown website has been revised, revamped. There will be interactive data available there, so I encourage you to visit it. And Countdown will also be working in countries around the world to do what we call country countdowns, which helps countries to look more specifically at their regional and subnational data and see where change needs to be made to improve reproductive, maternal, newborn, and child health. I won't talk too much about some of the other great global advocacy partners and initiatives out there, because you've already heard from them today. Women Deliver, the White Ribbon Alliance, we heard from Dr. Ahmad this morning, the Maternal Health Task Force, and the Campaign to End Fistula, amongst many others. These civil society-led initiatives play key roles of coordinating global and national advocacy messages, developing and sharing tools for advocacy, mobilizing advocacy and attention to MDG5, and holding governments accountable. So finally, what are the opportunities, challenges, and priorities going forward as we prepare to go back out into the world today and resume our good work? We need to maintain and strengthen attention and visibility to our issues, not just until 2015, but beyond. One way to do that is identifying new global, regional, and national champions. Now, you don't have to be one of the famous maternal newborn health brand ambassadors that we saw last night to serve as a champion. Each of you in your ministries, in your own work, can serve an important role of sharing stories, as we've done in these past couple of days, and making the case for improving maternal newborn child health. We also need increased investment, not just from global donors. We'll keep working on that at the global advocacy level, but also national investment in these issues. It's important to continue sharing evidence, not only through the countdown process and other data collection processes, but amongst each other, linking the continuum of care, taking some of the stories and the data that you heard in these past couple of days back and sharing them with the officials in your country. And finally, we need this continued work on holding stakeholders accountable. This has been such a theme in every panel, every satellite session I've attended this week. The good policies are in place. We heard from Anna that we know what works, but we need accountability to implement those policies, to make those programs real. Now is the time, not just because it's the last day of the conference, but because we are in an urgent time period leading up to the MDGs. I look forward to working with all of you and to continue being champions ourselves for maternal, newborn, child, and reproductive health. The time is now. Thanks.